Greetings everyone, this is Dr. Reheisse from Revive Sport and Spine, your Cottonwood Heights, Utah chiropractic and sports injury specialist. Today we want to talk about cupping, and more specifically dynamic cupping. So as a quick background, cupping is traditionally an ancient Chinese therapy. It's been around for thousands of years. Typically it uses a glass cup or cylinder, whatever you want to call it. The utilization of heat brings pressure inside the cup, pulls the tissue into that. Most people are familiar with it because it causes the round hickey marks on wherever the cupping therapy was done. But as we've learned more about movement, about the body, what we see these days is more of what's called dynamic cupping, and that is bringing movement into the equation here. So typically what we're going to do, and I want to demonstrate this, I'm going to use it as we would on shin splints, a common injury we see here in the office with runners, but this can be used on the low back, the low neck, the upper back, through the traps, the shoulder, many other areas where movement might be restricted. We might have some soft tissue tension, just tight muscles and some pain. So what we want to do with this, first of all, is just bring blood flow to the area. And through that, we want to create movement and then therefore increase range of motion and then decrease pain that way. So it's a great tool to use with other therapies. It wouldn't be something that people would come into the office and we would use as a standalone treatment, but it works very well with manipulation through the joints, with dry needle therapy and other therapies such as Graston or I-stem movements, where we can put the cups on, go through a full range of motion, and also be scraping the area as well. So modern cups usually come with just a pressure gun and have a pressure valve on them. So typically we're going to put them on the spots either on or around the areas of discomfort. We're going to act like we have shin splints today. I could always use a little bit more recovery, so I'm going to work on just my medial tibial area where shin splints are commonly felt. So we put a cup on an area and we create pressure through there. And what that does is sucks the tissue up into the cup. I can feel that pressure, and what is happening, at least what we think is going on, is that is stimulating, causing a little bit of damage to the blood cells. That's where that bruising comes from, and from that we get an inflammatory response, which is going to bring in a lot of cells that actually heal the area. So if you have some damaged tissue here, that's one thing that can happen. The second thing that can happen is just the underlying tissue. We've got fascia, we've got superficial muscles. What we're thinking is more of what's considered like the sweater effect or the shirt effect. If I pull on my shirt, while I have this tension here, it's also affecting further away. So if I'm pulling this tissue into this cup further away down the stream, or up the stream, or around the front of my leg or back of my leg, it's causing an effect on that now. And when we get into this dynamic portion, you're going to see how that affects that. We're going to walk around, do some movements, and it's going to change what's happening to my lower leg. There's two ways that we can make this more dynamic. So the first way is by the practitioner moving the cups around the tissue. Now this is an uncomfortable treatment, but it works really well, and what that does is as I move it, it pulls different tissues in there, allows us to go through tight muscles and dig out some of those adhesions and maybe really find that trouble spot that's causing the pain. So again, it looks kind of cool. It's not the most comfortable thing in the world, but it is effective as a treatment therapy. So I'm going to leave that one there. I'm going to put another one on. So we're getting pretty good suction on this now. The other way we make this dynamic is by movement. When patients are in the office and they have the cups on, whether it's on their low back, their shoulder, we want to stimulate some movement. So first of all, I'm just moving my foot up and down. What we can go to from here is I can walk around the office, I can go into a lunge position, I can go to the end range of movement, and while meantime I'm having these cups on that are causing to pull that tissue in there and causing that suction effect. So while I have pretty good tension here, I can feel this spread about my whole lower leg. And what we're thinking we're doing here is increasing circulation, but also we're affecting that tissue underneath there that could be adhesed, tightened up, and we're trying to break that up and loosen up so we can get a good full function of that lower leg. So as you can see, I'm just walking with this on here, going through a full range of. In the meantime, these muscles are contracting underneath there. I can go down into a lunge position and go deep into that and then come back out. So while I have a lot of pressure here, I'm still feeling that down here. So I've taken the cups off now. Typically we'll leave these on anywhere from 3 to 8 minutes, depending on how much movement and what we're trying to accomplish. But as you can see, even in probably the 3 minutes taking me to do this video, I had a pretty good response around this one. Not so much down here. I'm betting that one will be a nice bruise tomorrow. but that's part of just the circulation increase that you're going to get to an area. And that little bit of damage to those blood cells and to the pores of the superficial layers there is going to cause a little bit of an inflammatory response. And we know that in inflammation, it's going to bring in a lot of healing agents to this area. So that's part of the reason why we do this, is if you have an area like the Achilles, lower leg, that doesn't have great blood flow and generally takes a little bit longer to heal, this is a good way for us to, combined with dry needling and scraping, ice-stim maneuvers, we can bring in a little bit more blood flow to this area and hopefully speed up the healing. Again, we use this on everything from running injuries like shin splints, Achilles issues, IT band issues, to low back pain, shoulder tightness, and things like that. So if you've been stagnant with your rehab, this might be a good option for you. It's something we typically use on about half the patients that come through here. It's all case dependent, but it is a good tool for us to use to help you recover faster.